This is Health Jump, and I'm Ryan, and we're here with Ian McClendon. The two of these folks, they both work in some government agency projects on a recent public health project.
Correct.
And one of the things that we're going to be discussing that I'm really excited to hear about is we've all seen how the effects of COVID has had an impact on a lot of providers. You've got some experience here on the public health infrastructure that has been projected forward, and hello, future, welcome. So I'd love to hear more about your experiences on what's been happening.
We've had lots of devastating effects from COVID-19. It seems like it's kind of never-ending situation we're dealing with. We do seem like we're on kind of the tail end of it. One positive impact of the COVID-19 pandemic is it's really drawn attention to the fact that our public health infrastructure is woefully inadequate. There has been a tremendous increase in funding for public health infrastructure and data recently. And so, healthcare consultants like me and other private entities are involved now in trying to modernize and migrate public health infrastructure to the cloud. And so we're working a lot with the state and local governments to do that. But it's a bit of a challenge, right? As Jose knows, and having worked in some of this, there's something called the Constitution, which limits the ability of the federal government to tell states how to do things. Every state has different laws, they have different regulations, so it's really a consensus building exercise to get all of the states to agree. And so that's what we've been involved with over the last couple of years, actually. Building that consensus, helping the states to understand now is the time to modernize, to bring some of the private domain technologies, machine learning, AI, that sort of thing, to the public, right? And so you're going to see a lot more of this sort of public health modernization over the next couple of years. When private companies have a data breach, they've been in the news quite a bit. So you've got Equifax, who leaked, I think it was something like 164 million customers worth of data, the social security numbers, the private information. It's bad, but when your government does it, it's especially bad. The states are still leery of giving their data to the federal government.
Sure.
And it's not only the states' rights is certainly a factor. Currently they have their data in sort of the siloed infrastructure, on-premise solutions. It's a lot more protected, they can manage it. We're saying, give us all of your data, let us consolidate it, put it into the cloud environment. And that's something that really, rubs states kind of the wrong way. And it's really kind of one of those things where we're saying, there's a lot we can do to protect state data. I mentioned earlier, federal government can't come in and tell the states what to do. They can't say, you will improve your public health infrastructure. What they can do is they can provide funding. If you think about a government entity, how do they get more funding? How do they raise more revenue? Primarily taxes or, issue bonds, which is a special scenario. But if you're a local politician, you don't want to raise taxes, right? You're going to lose your next election. So the alternative is to get funding from the federal government. And a lot of times that funding is provided based on the stipulation that the state takes a certain action. They use what's called a cooperative agreement. The state and the federal government say we're going to cooperate to achieve the goals of improving the lives of our citizens. When the COVID outbreak happened, Congress and the president said, well, where's the data? Where's the real-time reporting of the data? There was a big lag there where states had to go build this infrastructure. They relied a lot on private partnerships to help build the infrastructure to collect the COVID data. Unfortunately, COVID is going away now. So you're left with the rest of the public health infrastructure, which is in really dismal shape.
So, we've talked a little bit about the policies, we've talked about the finance, right? We've talked about the culture. So maybe we can close off by talking about the technology, right? How do you kind of introduce these technologies to states that are really still operating off of very old, antiquated IT infrastructure?
I would say I really advocate for the cloud, right? So the cloud is something that vendors have really invested in, something that is constantly being updated by Microsoft, Amazon, Google, pick your flavor of cloud there. And we can continually introduce new technologies and train the states on new technologies when the infrastructure is in the cloud, versus if they're hosting it in their own state health department, it's siloed, it's antiquated technology. So I think the cloud is definitely the way to go. Eventually, I'd like to see state governments be somewhat on par with private industry technology-wise.
Sure.
That's really the end goal.
We all got a lot of misconceptions. So what are your favorite misconceptions that you hear that people say?
I'd say the biggest misconception is that, you know, the folks operating government technology, federal, state, local technology, are just incompetent and inept. Some of the most driven and dedicated people are in the federal government, state and local governments. They really, really care about public health. If they were doing it for a paycheck, they'd be somewhere else, right? They're doing it for the mission, they want to serve the public. There definitely is a cultural barrier in that we've done things a certain way for 20 years. It's very difficult to upend that and to change to new systems, to new processes, to new ways of doing things. Part of the modernization process is to help train people and implement that change management to help them understand newer technologies, newer ways of doing things, and the advantages, right? So if you give somebody a new process and say, just do this, it's going to take you 6 months to learn, they're going to say, why should I do that? But if you tell them this is going to enable us to have real-time data, you know, versus 2 years old stale data, I think that really hits home with a lot of the folks who are mission driven. One of the key things about having this stale data is, you know, the mission of public health is to do surveillance and monitoring, right, on new and emerging trends. And if you have the 2-year-old data, you're not achieving your mission. You're not doing that surveillance and monitoring effectively. Unless you have data that's a little more up to speed, up to date, you're not fulfilling the mission of public health.
I don't think people realize just how many people are doing this job for the love of trying to solve a problem that's going to have an impact on their lives, our lives, and the lives around us.
Yeah, no, teachers and first responders get a lot of recognition, but, you know, where's the love for the public health experts, right?